here at Mobile Infirmary with Dr. Mina Jacob. Dr. Jacob, good morning. Thank you so much for being here with us. All right, so we're talking about several different topics today. I wanted to start by asking you about aortic valve stenosis. Tell us a little bit about this.
The aortic valve is the outflow valve for the whole heart, which acts like a pump. So it exposes us to a high pressure and makes us more susceptible to degenerate, more so than the rest of the valves. And it's a disease of getting old, so it's common in elderly population.
What happens if this is not treated?
It's eventually it gets to a point where it compromises the heart function and makes patients susceptible to getting short of breath, having chest pain, passing out.
Now, traditionally, what is the treatment for this?
Traditionally, it has been surgical, so patient will have to go to an open heart surgery where the valve is removed and replaced by either a mechanical or a bioprosthetic valve. And it's again, it's a surgical procedure, consists of at least 5 to 7 days of hospital stay.
What sets Mobile Infirmary apart from the others?
Well, Mobile Infirmary program started early last year, and it really developed a very strong, dedicated program where they try to do everything as perfect as possible from the beginning. So they had the best hybrid room in the Southeast, and also they had a very advanced program where they trying to provide everything as best as possible for the patient.
Also joined now by Dr. Stan Thornton, and he's going to tell us a little bit more about aortic valve stenosis. And I like that you have a prop to show us here, Doctor. So tell us what we're looking at here.
So the aortic valve is the last valve that blood passes through as it leaves the heart to supply the body's need for blood. In aortic valve stenosis, the valve does not open properly, creating a very small opening through which blood must pass to get to the remainder of the body. The problem is this creates pressure inside the heart and could lead to symptoms such as chest pain, shortness of breath, and even fainting spells.
Now, this TAVR treatment is cutting edge. You have it here at Mobile Infirmary. Tell us about this type of treatment.
We do. So this is a less invasive way to replace the valve. The valve is actually mounted onto a small balloon catheter that's inserted through a tube in an artery, either in the leg or sometimes directly through the tip of the heart. The valve is crimped onto the balloon. The balloon is inserted inside the old valve and inflated. The balloon is deflated and removed, and you have an instantly functional heart valve with no open heart surgery.
That's incredible. Now, what is the benefit to the patient? Why is this so much more improved over the previous ways of doing this?
This is a less invasive way to accomplish the same thing. The risk of heart attack, stroke, and death in most cases are less with the transcatheter aortic valve replacement. Also, the length of stay is on average 36 hours. For typical open heart surgery, it may be 5 to 7 days.
Wow, that is a major difference there. Now, tell me about what y'all offer here at Mobile Infirmary with TAVR as opposed to other places. Why is it so great to have this procedure done here?
The thing that really sets us apart, there are two that come to mind. This beautiful facility that we're standing in today was based on the foresight of the Mobile Infirmary and the generosity of the Infirmary Foundation. This is a state-of-the-art facility that was created specifically for this type of complex procedure.
All right, Dr. Thornton, thank you so much for joining us here on Studio 10. We appreciate it. We'll have more information online, the Studio 10 tab on fox10tv.com.